The following portion of Bloom is sponsored by Central Florida Behavioral Health Network and the Department of Children and Families.
Welcome back to Bloom. Research supports that if a student has been affected by childhood trauma, it will likely disrupt their way of learning and could lead to substance use disorders. Here with more is the president and CEO of Central Florida Behavioral Health Network, Alan Davidson, and the founder and executive director of Florida Recovery Schools of Tampa Bay, Tina Miller. Thank you both for being here and welcome to Bloom.
Thanks for having us.
Thank you.
So, Alan, I understand that CFBHN is a managing entity. Can you explain to our viewers exactly what that means?
Sure. So we're a managing entity. We're one of 7 in the state of Florida. We're the largest in population, the second largest in landmass. So we fund a variety of behavioral health services. Think of us as the safety net for those that don't have insurance for behavioral health care. So we fund services from Pasco County down to Collier County, over into Hendry and Glades and up into Polk, Collins and Hardy. We fund a variety of services from mobile response team, care coordination, crisis care, detox, and also we get the pleasure of working with Tina and fund kids services at schools.
And Tina, talk to me about what you do and how you help so many youth in our area.
So Florida Recovery Schools of Tampa Bay is a nonprofit, and we've opened private high schools for teens ages 14 to 19 years old with substance use disorders or co-occurring disorders. And we provide all mental health services, recovery support, and they can earn their diploma with us.
So this sounds like it's an incredible resource for students. And exactly how does it all come together?
It comes together by people referring, parents, drug treatment centers, different juvenile probation officers. They refer a student to us, and then we assess them to see if it's a good fit for them to attend our schools. But we also refer them out for a higher level of care sometimes. But then we provide all of those services to that student.
That's really incredible. And I understand also mentors come into play with this.
Yes, yeah. So I had some students that graduated and they kept coming back to school, and I'm like, you have your diploma, you don't have to come back. And so I actually created a mentorship program. So I have 5 mentors right now, and we pay them and we job coach them. But that peer-to-peer support is really a huge positive influence on our students.
Yeah, I think if a youth can see the changes that could be made in their own life through another young adult, that's going to be very impactful.
Yes, yeah, and all of our mentors have at least 1 year of sobriety.
That's incredible. And Alan, how important it is to work with organizations like this so that you can really cast your net a lot further.
I tell people all the time, you can put funding towards crisis care or you can put funding towards prevention. And I talk about Tina being on the prevention side, that you catch kids early, so later on they're not going into deeper end services like detox, and we can actually improve their lives at 12, 15, 17 instead of waiting to 55.
Yeah, I think that's incredible. We take it for granted. We think every child has a family and support system behind them, but that's not always the case.
No.
So it's really incredible what you do.
Thank you.
Well, thank you both for being here today. All right, for more information on Central Florida Behavioral Health Network, visit help.hopeforsuncoast.org. And to see programs available to support the youth, visit FloridaRecoverySchoolsOfTampaBay.com. Bloom will be right back.
The preceding portion of Bloom was sponsored by Central Florida Behavioral Health Network and the Department of Children and Families.